evening at 11:16 p.m. So good to see everyone. Good to see everyone. Yeah, I just came back from the gym, had a shower, did all that, and now we're chilling, wrapping up for the day. I was actually just reflecting on the concept of dopamine detox. And basically, what dopamine detox is that you want to keep your dopamine low during the day. So that way, when you do something that's like not super fun, then that becomes fun for you. For example, like today, literally all I've done is just work on my business. So let's see, I scripted some lectures this morning for my program. Then I did some stuff for my private practice that I had to, like state licensures and things. Worked on the marketing side of things, right? Like scripted out a couple of new videos on the marketing end. So like those are all updated in my about page, and went to the gym, and here we are. Here we are. So yeah. But my point is that when you do that, the reason I can do that and it's fun is because I have no other dopamine source during the day. Like I'm not playing video games, I'm not scrolling social media, I'm not watching any TV, because all those things, they skyrocket your dopamine. And if they bring up your dopamine, then doing boring shit like scripting a marketing video is not going to be as fun. So that's why you want to keep the dopamine low, so that way all the boring stuff actually is fun for you. Like that's the key. And yeah, I think that's the secret that no one tells you, right? And that's how these companies, the social media, the government, like that's how they keep you down, is by funneling all this content for you and free social media and all of that, is because they keep you down and they keep you from rebelling. And mainly like people will just complain about the problems in society, but they won't do anything about them because everyone's on their thing for addicted to their content. Right? So that's the content is the new drug that they are feeding you. Never, ever, ever forget that. We live in an attention economy. So if you're not paying for it, guess what? You are paying for it. You're paying for it with your attention. That's the thing that you are paying for it with. So that was my shower thought for the day. So yeah, I think why don't we just get rolling here? All right, we got some people rolling in too. Our friend Sav here says, I am on 2 Gs of Abilify. It's starting to not work as good. Yeah, 2 Gs of Abilify. That's I mean, I assume you mean milligrams, but that's a very low dose. That's like that's a little starting baby dose. So that might just be candy. I love when bro goes live. Sounds like the documentary I recommended. Yeah, it's so true. It's so true. What's like the Matrix? Like once you see it, you can't unsee this stuff. And I've been having a lot of time to reflect over this last month or so. So I've definitely been making some observations. What can women do for pain and GABA reduction during period without medication? Oh, good. That's a good question, parents. So we actually just talked about this in our coaching program. One of our students asked a call about last week, about how to treat PMDD without meds. So I'll walk you through both strategies. The med strategy is that you use an SSRI either during the whole time or during the luteal phase, which is like the 2 weeks before the menstruation. So that's one strategy. Or you can use OCPs. The non-med strategy is to use zinc, calcium, and chasteberry. So those compounds are very helpful. I like omega-3s as well in there too, and iron, because probably there's some blood loss. Maybe just want to check, make sure it's normal. But definitely the calcium's shown the most evidence, and then zinc has shown evidence too. So you definitely want to incorporate those for period without pain reduction. That's key. At what dosage does fluoxetine become impactful? It depends on the patient. I've had patients get real good results at like 10 to 20 milligrams, and others need like 80. He's so smart. Thank you. Yeah, we gotta use our edge. Do you have other family members in the field, medical field? My sister is in podiatry school, or she's in podiatry residency. But other than that, no. My mom is she was a housewife, but then she also did she had a furniture store for a bit, and now she does some real estate, and now she's getting involved with my business. Like she's posting all my social media content other than on TikTok. So my mom posts all that, and what is she? And she's helping with like the school stuff too, like posting on like the videos and things on school. So I'm trying to get her involved. I'm trying to make this like a little family business thing. That's my goal. I have a huge fear of falling and just did a 30-minute exam. I have anxiety now. I don't even understand what you're saying. Like those things, I have a fear of falling, then you did a 30-minute exam and you have anxiety. Like, I don't understand. Why don't I see comments? Mom sounds like an entrepreneur. No, I'm just training her. I'm just teaching her like one by one how to do these things. But she's the one who's been uploading a lot of the lectures I've had to teach her. But slowly we'll make her into an entrepreneur. She has been an entrepreneur for like like brick and mortar stuff, but all this online thing is super new to her. So knowing the online game is different. Does buspirone do anything? I've been on it for months. Yeah, a lot of psychiatrists actually do believe that it is a sugar pill. I mean, I'm not that extreme about it. I think that it's helpful for some people. I've had some success with it, but it's only helpful for like mild, maybe moderate anxiety. And it's usually best used as an adjunct to SSRIs. What about your father? Insert Freud. Freud was more with mom, especially as a man. One time I took Zyprexa for a sleep aid and I slept 3 days. Yeah, Zyprexa is not a sleep aid. Doctor, can you give hydroxyzine and diphenhydramine together? Ideally not. They're both like very, very similar, so I would just pick one or the other. She said that hoodie looks so soft. Oh my, this hoodie's probably like the best thing I've ever come across. Like, I don't know, I just found it. I was in my house, in my parents' house here. I have no idea if it's my sister's or my dad's or my mom's. I literally have no clue. I've never purchased this thing, but I found it in my parents' house and now I'm taking it. I mean, now it's summer, so I don't really need to take it, but like I almost feel like it's iconic. Like this is my live hoodie. So like I always wear this hoodie whenever I go live. Ahmad said, "Do all benzos make you sleepy, or are there some that don't?" Uh, yeah, they all can make you sleepy. Uh, yeah, because they all hit the same receptor. They hit a receptor called GABA receptor, so they all make you sleepy. Um, yeah, yeah, yeah. There's nothing else to say on that. What are your thoughts on nortriptyline? Clothes hit better when they're not yours. Yeah, you know what? No, food hits better when they're not yours. That's the thing. Food hits better. It's like it's like when you go to a place, right? Do I want fries? No. But oh, the person next to me ordered fries. Okay, I'll have a couple of theirs. Like those fries always taste the best. I have a huge fear of failing my exam. I mean, that you got to prepare, right? Like that's the only way that you can prepare. The only way you counteract that is you prepare. Because remember, one of my favorite entrepreneurs says competence comes from competence, and competence comes from you do something so many times that you get comfortable with it and you become good at the thing. That's where confidence comes from. Confidence isn't like a fake thing that you can, I mean, you can fake it for a little bit, but like the internal confidence is not, it's not faked. So that's something I was actually saying to my, in my coaching program. What I was saying is that like now, right, I'm board certified attending, right? I have my own private practice. And so I feel confident that I can treat the vast majority of patients who come into my office because that's confidence that's come from competence of going through residency, of going through fellowship, of learning all this stuff, being a content creator like this. Like, I've learned so much just from being a content creator, right? Because I constantly have to be looking stuff up, being on top of my game. And yeah, so that confidence comes from competence. So, right, if you're anxiety for your test, then you need to make sure that you are confident in your test ability. Jay says, have you ever utilized wakefulness promoting agents for off-label ADHD treatment? Yeah. I had I remember I had when I was doing work at this community mental health center, I had this lady who, I think she had 3 kids and stuff. She had this demanding job. I mainly run into this with like people who do a lot of shift work, but she was like very tired during a lot of the day. And so we prescribed modafinil for her, and that really helped her out. She was able to get through a lot of her child caring responsibilities. I remember what it was. She should work during the night, but then she had to drop off her kids. So she had to stay awake until like 8:30 a.m. to drop off her kids at school. And then she had to be there to pick them up when they got out of school around like 3:30 or 4 or whenever. So that window during the day was the only time she had to sleep, and the rest of the time she had to stay awake. So, and that was very difficult for her because she was functioning on low sleep, but she couldn't really do anything about that schedule. So I'm like, okay, let's go with modafinil here. And that made a huge difference for her. I started Wellbutrin a few months ago. I see progress, but I have heartburn all the time. What do you recommend to help with the heartburn issues? Maybe Pepsid, Tums. I'm glad that the Wellbutrin has helped. Pepsid, Tums. Take the Wellbutrin with a bunch of food, like a big meal. That might help. Unless the meal's too big, which could worsen the heartburn. So you might have to experiment to see what size of meal is the best for you to take. Yeah. Maybe make sure you're upright as well too, not laying down. Chess City to Farm. Hello. I am a Psych NP and hot. Can we go on a date? Well, if you're a Psych NP, then you probably want to join our coaching program, and then we can verify your clinical skill. And then after that, once we hop on a coaching call, then we can see where things go after that. That would be the process. I took myself off lorazepam. Nice. Where did you go to undergrad? So I went to undergrad at University of Alabama at Birmingham, UAB. Actually, no, these are my med school yearbooks. Yeah, so I went to undergrad at University of Alabama at Birmingham, but then I went to med school at University of South Alabama. So like those are all my yearbooks from South. So yeah, this was all of our every year we had like a yearbook of all the things that we did and the clubs we were in and all that stuff. Yeah, I graduated med school in 2019. I did it 2015 to 19. So this is like 5 years ago, 6 years ago at least. I can't even remember if this was not my graduating class. But I probably have a photo in here. I'm sure my photo's in here somewhere. Oh, this was our first year class. Oh, LOL. This is the one that I had during my first year of med school. So this one's from 2015, and if you see, I'm right there, right there. Oh, this is my fresh at 22 years old. Jesus Christ. Yeah, that's a little 10-year difference. That's crazy. But yeah. Yeah, time flies. I'm crying. LOL. Airbolt. Are you hiring? I am not hiring. No, it depends. What are we hiring for? No way. No, we know each other. I was like, this can't be him. Who is this? Are you allowed to prescribe to yourself? I prescribe to myself, yeah. You can't prescribe to yourself like Adderall or something, but you can prescribe to like I prescribe to yourself hair loss meds. Uh, yeah, that's about it. Maybe my albuterol inhaler. That's pretty much it. My cousin did med school at UAB. Yeah, no, UAB was great. So I went there for undergrad, but then I was like, okay, kind of want something different. So that's why I decided to go to South Alabama for med school. Sometimes I think maybe I should have gone to UAB because, like, all my friends stayed in Birmingham for a couple years, and I did miss. I missed like them all hanging out with each other because this was like when they were still single or maybe they were still dating like their girlfriend. Now most of my friends are married, settled with kids and stuff, so they don't really hang out and things like that anymore. But during that time, there's like a couple years after college, they hung out a lot, and so I sometimes I regret not going to UAB for med school because I'm like, man, like I would always see the group chat pop off and they're always meeting up for trivia and things, and I'm like, oh man, I wish I was there. So yeah, but yes, this is Marissa. I was a DG. Oh, nice. Yeah, yeah, we were super close with DGs back in psychiatry or back in college days. Can a psychiatrist diagnose themselves? I mean, like, yes and no. They have the clinical knowledge to probably do it, but they don't have the objectivity to do it. So, what were your favorite rotations in school aside from psych? I mean, psych was definitely my number one rotation. Like, that's the one like I went like super gunner mode in. Like I was always reading. Like I did my highest shelf was in psych. That was the only one where like people were coming up to me and asking me for questions, like asking me for like advice. None of the other shelves that happened. Trust me. Uh, honestly, not all the others were kind of like eh. I like family medicine actually. I like family medicine. I've always liked the more patient centric, those kind of stuff. I like neurology too. I thought neurology was really cool, but I don't want to do like a neurology lifestyle. Like stroke calls and things. I was not a fan of internal medicine or surgery or OB-GYN. Basically, like those hours where they just like kill you. Yeah, those were our rotations. If you see me in your coaching program in 2 years, you better remember what you said. LOL, you'll have to remind me. When you got into med school, rip, I lost it. When you got into med school, was it psychiatry you wanted to match into? Yes. Yeah, yeah. I wanted to match into psychiatry. It was either psych or maybe family medicine. I went in thinking like 70% psych, 30% family med, but like by a third year, like I knew I was doing psych. Like I was pretty sure. Most of my extended family went to UAB, great teaching hospital. Yeah, I loved it. Have you tried ChatGPT? Yes, ChatGPT is my best friend right now. I take 200 milligrams of trazodone. I sleep for 12 hours. What's your son's? Oh, you're not talking to me. 200 milligrams is a lot, though. My son has sleep issues. Trazodone is too strong, hard to wake up. Can you advise? It depends on what the dose is. Thoughts on Dr. Mike and Dr. K's YouTube debate on Eastern versus Western medicine? I don't know. I haven't watched it. I don't keep up with like celebrity and celebrity dramas and like stuff like that, right? It's just content. They're just creating content together, and like that's a cool idea for content. So that's pretty cool. Does this career follow you home? This is my career. Like this is my life. Like I'm self-employed. I don't work for anyone. So it's like for me, I don't like have like work-life balance. For me, it's like career is my mission. Like this is what I'm trying to accomplish. So every day, every hour of the day, this is what I'm thinking about. And life is life, social interaction, family interaction, fun. All those are like things I sprinkle in. Like my family wants to go on a trip to Iceland. And my sister really wants to go. She doesn't get that much time off. Like the whole family's going. Like I don't even want to go. Like I'm going because I'm forced to go. I would rather just sit here and work. Like I swear to God, I would rather sit here and work. I just want to work on my coaching program, work on my business, see my patients. Like I would rather do that than go on a fucking trip to Iceland. I'm just saying that's what my priorities are. You got to put the big rocks in first, and then the sand comes in after. Do I sleep? Yeah, I sleep. I sleep 9 hours a day. Like I go to sleep around 1 a.m., wake up around 10 a.m. Yeah, sleep is the most important thing. I think sleep is better than any skincare. It's better than any like mood stabilizer. I mean, I'm being facetious, but it's definitely better than any skincare. It's better than it's better than a lot of psychiatric meds. I will tell you that. If you're able to get a good night's sleep, you can do wonders for your mental health. I will say that. But nobody ever sleeps 9 hours. So it's like, I feel the best when I sleep 9 hours and I wake up and I know I've had a good night's sleep because I do not want any coffee or caffeine because I think they'll make me too stimulated. And I'm like, no, I feel great. I feel happy. I feel ready to go on with the day. I have no energy lapse. And I know it's 9 hours for me because on the weekend, I was on call this weekend because I do some prison call stuff. And I only slept maybe like 6 hours just because like I was on call. And like the next day, I almost felt like a wash. Like I almost felt like I didn't want to do anything. And I had to really grind through the day. But like a day where I sleep 9 hours, like I wake up happy. I'm like, yeah, let's get to work. 50 milligrams. Yeah, you might want to try 25 then, or 37.5. Why do I always watch everything in 2 speed, even on TikToks? Yeah. No, that's good. I remember med school ruined that for me. Like any student who's watching video lectures, it gets ruined. Like, because one speed is so slow. I watch everything on 2 speed. I watch every like I'm not like movies and stuff, but like every video I see it's on 2 speed. Every YouTube video I watch, every podcast I listen to is on like 2 speed or 1.5. I find that 1.5 is the sweet spot for me, where I can still retain a lot of. But yeah, like every med school lecture was like 1.5 ish. I had a med school buddy, and like his study was literally just like listening to the lectures, and he would listen to it like 2.5 or 3 speed. He would just like listen to it. How do you choose which SSRI to try first? It depends. So it depends on like comorbidities. So if I'm trying to get something more activating, I'll choose Prozac. If I think the patient's not going to take their meds, I'll pick Prozac. If I think that the patient is side effect sensitive, I'll pick Lexapro. If they have more anxiety, maybe there's some PTSD going on, I'll pick Zoloft. If they maybe tried some stuff already, but they had some benefit on Lexapro in the past, maybe I'll consider Celexa. Or if they just liked it for X or Y reason. Paxil, I'll pretty much only consider if the patient really needs some sleep at night and I don't want to use anything else. And Luvox I'll use for OCD. Thoughts on bipolar 1 and Adderall? Yeah, you can take Adderall on bipolar 1. You just have to make sure that you're stabilized first with a mood stabilizer. Do you have any experience with Aplezin? I don't know. How would you differentiate between PMDD and BP2? Those are very different. PMDD, your symptoms will occur during your two weeks before your period, and BP2 can be random. Do you suggest NAC for OCD? I do. Yeah, whenever I prescribe for OCD meds, or OCD treatment, I'll always start NAC first. Thoughts on the Balvi? Yeah, I mean, it works. I mean, it's just olanzapine plus some weight loss stuff, but it's just like so expensive. I've never prescribed it personally, but there's some good data on it. I mean, metformin is usually what I go to just because like cheapness, easy, financially able for the patient, but I'm starting to look more into GLP-1 agonists. Doc Talk says, is there data showing psych meds decrease mortality related to the condition involved? I'm not sure on that. I'm not sure on what the data is. I think with psych meds is more just like, they're to help with the symptoms. Mortality is not the only metric that you can use, that you should use to assess whether something is successful. That sounds like a surgeon way of thinking, right? Quality of life improvement is very important too. Just because there's no improvement in death rates doesn't mean that the quality of life wasn't important. Hi, Nicolette. How do you feel about GeneSight testing? It's okay. It's not the best. I actually just made a lecture on this in my coaching program where, I talked about GeneSight and it said, I made it last week, and basically my opinion is that it's okay. I think that it predisposes a lot of patients to thinking that, oh, this med's going to be bad for me, when no, really that's not the case. Med still might work even if it's in the red, quote unquote, but a lot of people get predisposed that, oh yeah, this isn't going to work. And if once you've looked at enough GeneSights like I have, like the same shit's always green. Like it's Prestige, Fatsima, maybe Wellbutrin, because those are just not metabolized by the things that GeneSight looks for. So it's like every patient thinks in the mother thinks that, okay, Prestige is now the go-to option, but it might not be the right thing for them. So yeah, that's my opinion on GeneSight. But it can be helpful if the patient's failed some stuff and I want to maybe like get a little bit more guidance on how to dose. ROP IM for premature babies. I don't know what that means. Best way to find a psychiatrist in Arizona or licensed in Arizona, then Yelp. I actually have some colleagues in Arizona. So yeah, just send me a message, and yeah, I can connect you. Let me put up that message thing. Yeah, exactly. And so especially if you want to book a consult with me, that's the best way to do that too. Send me a message and I can send you a link. Or if you're interested in the PMHNP program, right? You're someone who's felt like, you haven't got good training, you feel like an imposter syndrome, you're always like looking stuff up and you're not feeling confident in your skills, or you really want to feel really good about your prescribing, right? You want to feel confident in your treatment. You want to feel like you know what you're doing, right? And you really want to understand psychiatry to an in-depth level, right? That that a psychiatrist does. Then definitely look at joining. Can you explain in comparison and similarities of neurological disorders and acquired neurodivergent symptoms? I'm not sure what that means exactly. Yeah, all the details are in my consult form for therapist talks. You look like Beyonce. Do I now? Why do Vyvanse? Excuse me. Why do Vyvanse works great for most people? It works great for some people. Doesn't work great. I wouldn't say most people. Looks great if you're a good candidate. What do you think about taking Lexapro at night? It's fine. It's fine. How rare is multiple personality? It's pretty rare. It's pretty rare. Yeah, it's pretty rare. I've seen like one or two cases. I remember one case I saw. I was in the child inpatient unit, and this girl came in who thought that she was a 37-year-old Jewish man, so she would be wearing like traditional Jewish clothing. She had on the yarmulke as well, and would like act and talk and behave as she was like that. And apparently like this was a thing, like she was a normal girl, like 13, 14 years old, and then she would have this phase where she would really go into it and then kind of flip back. And then there's one time, I can't remember why she was admitted. I think it must have been for unalive thoughts or something, but she stayed that way for like a lot of the inpatient visit. And then I think near the end of it, she went back to her different, like her younger girl personality. So it's rare, but I have seen it before. Can vitamins be used for weight loss? Yes, it's used for weight loss and binge eating. Thoughts on the nose spray for depression? It's okay. Well, it's called Spravato. Um, I mean, I've never prescribed it, but people have to go to ketamine clinics to do it. Yeah, it acts pretty quick. So I recommend it I refer people for treatment-resistant depression. You bought those glasses at Xenia. I sure did. Sure did. I'm impressed that you know that. It takes a very special person to know that. Alternatives to mirtazapine that are more sedating. It's pretty sedating as it is. Like, I don't know why you'd want something more sedating. Depends on what you're trying to treat. I want them. Yeah, you just go to their website and get them. Get the dry eye glasses. They've changed my life, so that's why I wear them every single day. I went to the gym not wearing them. Well, I drove to the gym and then drove back not wearing them, and like my eyes literally are still irritated right now. So I was like, man, I shouldn't have forgotten it. Yeah, so yeah, get them from Sienna. If you use the code DHAWANMD, DHAWANMD, you can get a pretty good discount on it too. This is the one thing I was like, okay, like I don't want to sponsor products and shit, but this is like the one thing that I was like, okay, like these have changed my life. I got off all my dry eye meds, so like literally I will shout these on the rooftops, like these fucking glasses. Did you ever feel I'm buying them nice? Yeah, go ahead. Like literally the ones I have are called the Marinas. But like there's like a couple of different varieties, and what makes them really good is like this is like the right, because now they're just glasses, like whatever, right? But you need this with it, and then once you have this with it, like that's what keeps in the cave, because it shields your glasses, so now no wind and things can impact it. So that's the thing. Like my eyes are also kind of irritated because I picked up my cat and I didn't have my glasses, and one of her hairs fell on my eye, and I'm allergic to cats. So here we are, right? That was the problem. But yeah, use that code and you'll be able to get a discount too. Doc, you're up late tonight. No, it's not really late for me. I usually sleep around 1 a.m. and I go to bed around. I wake up around 10ish. So this is normal for me. You're up late tonight. Did you ever feel unsafe in residency during psych patients? A couple times, yeah. You're allergic to cats, but you have one. I do. I have a baby girl, and I love her. Her name is Nami. Her love language is physical touch, and she doesn't care about treats. All she cares about is a little bit of food. She's not an overeater. She just wants enough food to keep her satiated and cuddles. That's all she wants. Does mirtazapine sedate work for everyone? Happens at 7.5 to 15 milligrams. That's the ideal time, the ideal sedation dose. Do you think someone who has daily SSRIs always requires hospitalization? No. No, those are the patients who don't really require hospitalization. You have to do a risk assessment. Ooh, that's a good topic. I should make a risk assessment lecture in my coaching program, because that's a really important topic. I did a lot of that when I worked in the ER. I'm gonna write that one down. Risk assessment. Okay. Boom. How to clear your mind from negative thoughts. Yeah, so you have to, it's practice, right? So just like when you first go to the gym, you don't know what you're doing, you're still trying to figure it out, but then after a while, right, you have a routine, you get locked in, and then you keep progressing on the same routine, and it's called progressive overload, right? Like you start at the bench at one level, then you just go up, up, and up, and up. So it's the same thing with negative thoughts as well, too. So basically, you practice redirecting them to the positive, and at first it's hard, but then you keep practicing, and it gets better, and you keep practicing, it gets better, and you keep practicing, it gets better. And then over time, you become much more good at thinking about positive thoughts than negative. So for me now, whenever I have a negative thought, I'll literally catch myself and be like, wait, stop. No, you're not going to tell yourself that. What's the opposite? What's the positive thought you can tell yourself instead? Because your thoughts are the diet that you feed your mind. So don't feed it crappy food. You want to feed your mind good stuff. I have schizophrenia and I take Invega. Nice, yeah, Invega's good. We used to prescribe a lot of Invega for our schizophrenia patients. Can you repeat? I want to write that dot. Your thoughts are the diet that you feed your mind. If Lamictal causes apathy and low motivation, is it still an ideal medication if adding an ADHD later? I mean, you have to assess whether that's the medication that's causing it or that's the underlying condition that's causing it. What's your opinion on Eckhart Tolle? I don't really know. I tried reading his book, Power of Now, but it was like so boring and like fluffy, like, oh, so spiritual and stuff. I was like, okay, this is not like practical. But I understand the basic concept, right? Focus on the now. Thoughts on finasteride versus 3x versus daily? I mean, I just take it daily. I'm not a hair loss expert, but I just take the daily one. I don't know anything about 3x. You offer mentorship for PMHNP. Yes, so if you check my bio, that's the best place to see that. Because I was having a lot of PMHPs coming up to me and they were like, hey, can you supervise me? Can you collaborate with me? Can you be my preceptor? I feel like my education really sucked. I feel like I feel like no one ever taught me anything. I don't feel confident. I have imposter syndrome. Like I've heard all these things. And so that's why I created a coaching program so that way you can feel confident. You can learn from a board certified psychiatrist, all the stuff that I've learned in residency, you can download into your brain, right? And so that's the whole reason I created it because I wanted to help solve this knowledge gap that we have from like psychiatrists and then a lot of NPs who may not know they may not have been trained as well. So that's why I want to help that, right? Help solve this problem. So that's the key thing. Do you have opinions on PMHPs come out of online programs? Yeah. So a lot of them actually, they may not get the good training that they need to, right? There's differences in definite quality. It's not as standardized as you might think. So that's why there's a lot of stigma from MDs, like doctors, that to not trust NP work, right? And so a lot of my students have also told me this, that they've experienced that stigma. And so my advice to them is like, yeah, like, that's going to happen because of your credentials. You people will judge you. So what you can do is you have to become just so excellent that no one can doubt you. And the way to do that is to seek mentorship, seek learning, basically learn just like a MD would, right? And that's why I created my program to help give you that information and that knowledge and that mentorship. Cognitive behavioral therapy challenge your negative beliefs. Precisely, yeah. Can you take both clonidine IR and ER for sleep? Is that not recommended? I mean, I wouldn't stack both of them. I would usually just take one or the other. Is there anything I can do and take on the side to help my brain better even more? See, these are good questions. I would take fish oil. I would eat a ketogenic diet. Ketogenic diet's been shown to help with schizophrenia, with bipolar, with seizures. Those would be the top two things I would recommend. Cut out the carbs. Carbs are poison. Not veggie carbs, but like muffins, pasta, rice, sugar, all that. Can Wellbutrin help someone get out of a manic state? No, it would probably put them in a manic state. My ADHD meds quit working even with long tolerance breaks. What's causing this? So I had a patient. He is like a mid-40s lawyer, and he's told me something very interesting. He said that when he sleeps well, his ADHD meds work great. But when he sleeps poorly, then he feels like they barely work. So he's really emphasized his sleep. And I was like, wow, that makes a lot of sense, because it's like, just like, if you're very tired, you might need like 4 cups of coffee, but then if you've slept great, you only have that one, right? There's less for the medication to overcome. So I would say focus on all the other lifestyle factors to get your Adderall tolerance back up. Yeah. Would you recommend your program to both PMHP students or after graduation? Both, to students and after graduation, but definitely for students. We have a lot of students in our program, actually. And, something that they said is that, okay, now they feel way more prepared because they're here. And so now imagine if you get out of, you just get out of PMHP school, you start a new job, they throw 20 patients at you, and you're like, what the heck? Like, what is going on here? And you have no reference, no backup, like barely inadequate training or just barely average training, right? Whereas if you've learned psychiatry really in depth, right? Like you learned from a psychiatrist who went through residency, right? Because that's how I learned. We had 4 years of residency, and then plus I had child fellowship too. Now you're gonna come to that job and be like, holy shit, like I know what's going on. I feel prepared. I feel confident. Like I feel like, okay, I can actually help these patients and make a difference, and I don't have imposter syndrome. So my question to you would be like, okay, how do you want to feel when you start your job after graduation? Do you want to feel confused and imposter syndrome and just overwhelmed? Or do you want to feel like, yes, I know what's going on, and if I ever need help, I have a community I can reach out to for help? What can cause a 72-year-old with no history of mental health to have visual hallucinations? Well, that reminds me of a case I had. So I had this 65, I've told this actually to my community, but I have a 65-year-old guy, and this dude, I remember seeing him, and he was complaining of visual hallucinations. And so, at first I was going, and his brother had died the previous year. So I was going down, like, is this like a grief thing? Is this something like that? Because he was describing these like stick figures and like things he would see in the garage. And then, going to his med history, I noticed he was on amitriptyline. And I asked him, okay, well, how long have you been on this amitriptyline for? He's like 20 years. He helps me sleep. And I was like, okay, that's interesting. And so I took him off the amitriptyline, or I said, okay, let's decrease your dose of the amitriptyline. So I decreased his dose and then add him to some tapering. He comes back a month later and he's like, yeah, all that stuff is gone. So what happened was that the amitriptyline is anticholinergic. It's very anticholinergic. And when you're in your 40s, you can get away with it. But when you're in your 60s, it's a lot harder. So the amitriptyline was causing anticholinergic burden to him and causing hallucinations. So that's why I had him taper that. How much fish oils pills is okay to take a day? I take 4. So I take 3,000. I take 3,000 milligrams. That's what I recommend to all my patients. 3,000 milligrams of EPA and DHA. Fish oil is like really hard to overdose. Is there any medication to detox brain? How to find which job suits me, purpose of life? Yeah, I recommend this to my patient. To find your purpose, it's not like you just magically find it, right? It comes after years and years and years. So for example, like I didn't know that I was going to be live sitting here 10 years ago. Like, right? I had no clue. All I knew 10 years ago was like, okay, I've had some of my own confidence things, and now I want to go to med school, try to figure out, okay, how can I help other people with it? And then that led me, kind of going through med school and then going through psych residency, and then there in residency, I didn't want to be a child adolescent psychiatrist, but I had one teenager patient I was working with, and after working with him, I was like, yeah, I kind of really like that. And then that totally changed my track, and I decided to do child fellowship. And that was like a last minute decision. I actually applied after the match had already happened. And so like I got a spot after the match for child fellowship. And then after that, then then this whole coaching program stuff came up. So my point is that you never know. You just have to get started on something, and then you start, and it's like you're going through a maze, and then you can eventually make enough wrong turns till you find the right turn. Would it be worth paying out of pocket for brand meds if generics not working anymore? Yeah, I think so. Especially for a stimulant like Adderall and Vyvanse. I've had so many patients tell me that the brands work better than the generics, that like I believe it. How long can you be on Lexapro for? It depends. Usually I tell people, okay, stay on it until you feel better, then slowly start to taper 6 to 12 months. How many pills? It depends. There's 3,000 to 4,000 milligrams. What medications would you recommend for someone who experiences a lot of ADHD and anger? What meds would you recommend someone who experiences a lot of ADHD and anger? Probably like a clonidine or guanfacine. That would be my first thought. It can help with anxiety and the anger. Yes, I'm on a generic for it. I swear it's a placebo. I agree. I don't actually. I know I don't agree, but a lot of people do say that, so I don't doubt that experience. What is the side effects of using M for 10 years? You can pretty much fry your brain. It's very serious. I've seen it happen. Is there a med for depression that I can take without doctor's prescription? Yeah, you could try saffron or St. John's wort. Bro, Ivan, I told you, 3,000 to 4,000 milligrams. It's not how many pills, because each manufacturer makes a different amount. But you want 3,000 to 4,000 milligrams of omega-3. What medication or supplements would you recommend to help stay asleep? Magnesium. I take it every day. Magnesium glycinate. Yeah, it really helps. I feel like it really helps my body relax and get a body relaxed sleep. That's what I noticed with magnesium. Like I take magnesium and then I just feel like my whole body relaxes, and then I wake up the next. I feel like I sleep deeper too with it. I always sleep longer when I take magnesium. How much NAC for severe OCD? 2,400 milligrams per day, 1,200 BID twice a day. Yeah, how much magnesium? Start at like 100, go up to 500-ish. I take on normal days, like casual days, I'll take like 100, but if I really need to go, I'll take around 400, 500. What do you recommend to a patient with an alcohol problem due to boredom? I mean, fix the boredom. Find something else that gives you purpose, right? Something that gives you joy. Like, for example, for me, like, all I want to do, every day I wake up and I work on my business. That's what I do every day. I wake up and I work on my business. Like, that's it. Like, that's what gives me purpose, right? So, like, I don't even want to drink alcohol or, like, do any of that stuff because I'm not bored. I'm engaged. I'm trying to do something. So that's the key, right? You want to find something that engages you. And then all the addictions kind of just melt away. I know he got frustrated, LOL, but my screen froze when he spoke. Yeah, so that sounds like an internet connection issue. But no, I'm not frustrated. I'm just telling you decisively. 3,000 to 4,000 milligrams per day. Depends on the manufacturer. You want EPA plus DHA of 3,000. Now, look at whatever manufacturer you want to and then do the math to get to that dose. If you want a good recommendation, you can check out my bio and you can see one that I recommend. Each capsule has 1,000 milligrams, so that way you only need 3. Clonidine dropped my BP, yes. Is it safe to stay on an SSRI for years? Yeah, so I just answered that one, Kyla as well, but it can be, yes. As long as it's helping you, right? But once you're stable, you can try tapering it and then see how that goes. Glycinate, yeah, exactly. Can memory and cognitive deficits be caused by 4 years of Seroquel? Hand, whole body tremors. Yes, it can actually. That's a thing that we call EPS, and it can cause some muscle movement symptoms. Seroquel has some anticholinergic stuff as well too, so that could be causing some memory cognitive deficits. So I would recommend perhaps discussing these with your provider and seeing if you need to change or taper or do something. Do you recommend anything for brain fog? 9 hours of sleep. That's the main thing. Eating a clean diet. There's no like meds to target brain fog per se. Wellbutrin can help. Stimulants can help. Kind of clear out some of that fog. But yeah. How much NAC for OCD? Sorry, LOL. So 1200 milligrams BID twice a day, but you want to work up to that. You don't want to start at 1200. A lot of people find it like some GI distress, so start at 600, then you work your way up. And so you can also check my bio for that too, for NAC as well, and acetylcysteine. That's one I prescribe very commonly, very commonly. But yeah, I think can psychiatrists start someone on dementia medication without neuroimaging? You don't need neuroimaging for dementia. Dementia is a clinical diagnosis. If the person's having dementia symptoms, they're having dementia. I feel like SSRI is not my emotion. Yeah, a lot of people feel that way. Serotonin is a very calming neurotransmitter, and SSRIs just kind of flood the system with it. Can low dose Wellbutrin help anxiety? SSRIs don't seem to work because the ADHD aspect. Yeah, if it can help anxiety, if the anxiety is caused by ADHD. How do you get rid of restless leg syndrome? Check your iron. Make sure iron's not low. Can an SSRI cause an increased anxiety? Yeah, it can be activating for some people at the beginning. Best SSRI for OCD? I like Luvox. Do you know how to deal with asthma? Yeah, I don't. I mean, I'm using albuterol inhaler, but like, so actually, if I think back to med school, there's albuterol inhalers, there's steroid inhalers, and then there's oral steroids. So I think it starts with like a beta 2 agonist, which is a dilator inhaler, and then you can do a steroid inhaler, which is a little bit more intense. And then the more severe is an oral steroid, but it kind of stacks. Is it within a scope of psychiatrist to start someone with depression dementia? Yes, it is. Yeah. Does Pranol work immediately? Yeah, like 20 minutes, 30 minutes. Yeah. If I was on Lexapro 2 months ago, 5 weeks, so the chance it will work now. It will work now. I know, Melissa, you are very persistent regarding this Lexapro. So if you want my advice, I think you are focusing too much on it, and this fixation that you have on it is what's causing your anxiety and making it much worse, and it's going to make it much harder for you to get better if you believe that it will not work for you and you have this internal resistance against it. It's kind of like pushing something up a hill versus pushing down a hill. If you are resisting against it, then the Lexapro has a lot more to push to. It's like it's pushing uphill against you to work. Whereas if you kind of work with it, then it's going to go downhill. I hope that makes sense. Is it worth to get to school to learn psychiatry after 40s? I mean, it just depends on how much you want it. I wouldn't do it, but, because you give up your 20, you pretty much give up a decade, med school plus residency, of like not earning shit and just like learning. So if you want to, the oldest person in my med school was 38, maybe 40, 36. One person was a PhD. We had two. We had a lady who was a pharmacist, and then she became a family med dog, and then we had another who was a PhD, and she became an OB-GYN. Or that OB-GYN or pediatrician, one of the two. Might have been pediatrician. But yeah, if you want it. But I wouldn't do it personally. So yeah, I think now's a good time to call it. So it's about 54. We've been live for about 55 minutes right now. It's 12:11. So yeah, I hope this was helpful. As always, I'll be live tomorrow. Too. So if you're a PMHNP, right, and you really want to learn from me, then definitely just tune into the live tomorrow. We'll be going over our coaching call tomorrow, where I go over all of our members' questions, and you can check out the program as well in my bio or just send me a message. And yeah, if you're a patient and you want to work with me a little bit more detail, best way to do that is to just book a consult. And you can book a consult in my bio or just send me a message too. Otherwise, I shall see you tomorrow.